Hey, my name's Stephanie Pittman. I'm a nurse at UNCW in the BSN program, and for this project, the Transcultural Nursing presentation, my culture that I'm focusing on is the Arab Muslim culture. Objectives of this presentation: I'm going to introduce the cultural competence in transcultural nursing. I'm going to introduce the Arab Muslim culture and describe their culture, their beliefs and values related to healthcare and their view of health, providing therapeutic care across the lifespan, and then I'm just going to summarize it all in the end. So cultural competence is very important in understanding other cultures and dealing with them on a nursing basis. We need to know the knowledge that different cultures have, their attitudes, beliefs, skills, and the encounters with different cultures. We need to just enhance it and respect it and have appropriate attitudes when interacting with others. The religion based on this culture is Islam, which was founded between 610 and 632 AD, and the follower of the Islam religion is the Muslim, which just means one who submits. I thought that was very interesting. And according to our book also, Islam is the fastest growing religion in the world. And with any cultural difference, it's very important as a nurse that we assess the language abilities and understandings of these patients. Any verbal and nonverbal communication is vital. It's important for us to have appropriate communication. The Arab Muslim culture requires women to clothe themselves without any shape-revealing clothes. Their hair, their arms, their legs are to be covered also, as you can see in the bottom right picture. As far as healthcare, this culture is really big with family, including family and treating illnesses and decisions and treatments. And this includes the extended family also. That's very important to them. We don't want to just go up and hug someone, kiss someone, pat someone's hand, or even shake a hand or make eye contact. That's very uncommon in this culture, unless you're specifically asked or possibly the same gender. This never happens usually with opposite genders. This culture also, including with the genders, the women prefer to have women healthcare providers, and the males prefer to have the male healthcare providers. We definitely need to keep that in mind when caring for these patients. Also, when caring for these patients, we need to be mindful of their privacy. We need to make awareness that we're coming in due to them thinking it's essential for their body to be covered and presented well. They may refuse the bed baths in the hospital, and again, that's due to their privacy, and they need to just maintain this. Covering their bodies without exposing is very important in the Arab Muslim culture. As far as their medications for their care plans or treatment options, their medications are generally accepted. If the healthcare provider recommends this, they'll take it. But they do avoid any medications or over-the-counter medications with alcohol or narcotics. And as far as recovery in their treatment, they believe prayer is the number one thing. They pray a lot. They pray the 5 times a day, and this will help contribute to the healing and the health of the individuals with this culture. In one of my clinical groups in nursing school back at my community college I went to, I had a Muslim that was in my clinical group, and she was excused during those times to pray, and so it's very accepted for this culture. Moving on to caring for childbearing women and families. As far as breastfeeding, they like this in private to ensure modesty. They need their privacy and not exposing anything. They believe for their diet, moderation is essential. They don't eat pork and they don't drink alcohol. That's prohibited. During the blessed month of Ramadan, this is when they avoid foods during the daylight hours. The pregnant women, nursing women, they're both exempt from this fasting, but they're still expected to fast later in the year, or they can feed a poor person and make up for the missed Ramadan days, which is very interesting that they can do both of those. As far as medication like the birth control, it's generally accepted with this culture. Again, if the physician recommends it or advises to use it, then they will. During this month also, the children, including boys over the age of 7 and girls over the age of 9, they will be included in this month and are expected to fast. If they're under age 7 as a boy or under age 9 as a girl, they're not expected to do this. And during these years, they're learning about the culture and the practices, and the parents and the family are big role models to them. After the children years, as for adults starting at age 18, they're really learning their ways, and we need to respect their culture, and we need to meet their needs and provide care as a nurse as much as we possibly can. The Arab Muslim culture, they have the Quran, which is their source of faith that they use daily. They include this with their prayers and their learnings and studies with their culture. So they've got the 5 pillars of faith that are essential to their practice. And they have the rituals of praying 5 times a day, daily at dawn, noon, afternoon, sunset, night, and then facing Mecca, Saudi Arabia, and Islam's holy city. They have the profession of faith, they give to the needy, and they fast for the month. And then they visit Mecca once during their lifetime. That's part of the 5 pillars also. And these older adults are expected to practice their Arab Muslim culture and practice the 5 pillars of faith and the praying. It's just essential for them to do this. With all these cultural differences, and there are a good amount, we need to make sure we're communicating with these patients, making sure we're meeting all their needs. And we need to really assess and see if they can actually understand what we're communicating to them. If we need to get a translator, we need to do so to meet all their needs and give them adequate care. As for caring for the older adults of this culture, including 65 or older, we need to be sure that we meet their cultural needs and promote health and provide this patient-centered care for them. The older adults in this culture, we need to consider that the belief that the right to die is not accepted. Any attempt to shorten a life is prohibited. An autopsy is accepted only for medical and legal reasons. And also, as far as death, burying them, they follow the ritual that the body and the face should always be buried so that the head faces Mecca, their holy city. And as I mentioned earlier, these older adults are strong in their beliefs with their religion, and with their care and treatment and making decisions, we involve their whole family, including the extended family. And as nurses, we need to respect that and keep in mind that we need to make sure the family's in the room or included in their treatment plans. As far as in the community, as with any other culture, we need to promote health and have knowledge and understanding of these cultures. And I think this project is important for us to learn about cultures, knowing their background, beliefs, attitudes, and understandings of each culture to meet their needs and provide the therapeutic care in all the settings. In one of the articles I read, it was a study of cross-cultural communication, and they interviewed 34 healthcare professionals, and they assessed the perceptions of barriers to healthcare. And there were 5 things that were found out of this article, and that was including language, low literacy, lack of understanding, attitudes, including the genders, and their health beliefs. These were the main barriers that were found. And again, I think the most important thing in the community is promoting health with every culture, every difference, and we need to make sure that we meet the needs of all these patients. We need to provide effective communication, non-judgmental care, and then respectful care also. We just need to be aware of all these cultural differences and meet their needs as best as we can. I find this culture very captivating. There's lots to learn about. They're very family oriented, and they know all their beliefs and attitudes, and they practice this very strongly. They seem to be accepting of society, and they are respectful of other cultures as well. They have their own strong beliefs, but as far as any other culture, these beliefs are also valued, and we need to respect all the different cultures, and it seems like the Arab Muslim culture seems to respect different cultures also. For the previous transcultural assignment, I actually interviewed a lady who is from Saudi Arabia who practiced this culture, and this is why it was very captivating to me to learn more about it and learn about different cultures to better meet the needs of these patients. The Arab Muslim culture, they really do celebrate happiness. They're very strong in the prayer. They pray the 5 times a day, and they believe that this prayer can help heal. They have their God in which they believe is above all. And again, I find this culture very captivating and motivating, and learning about different cultures is important for all nurses and healthcare providers, and just respecting their beliefs. And lastly, here is my reference page. Hope you enjoyed the presentation, and I'm eager to learn about more cultures and just promoting this health and wellness and just awareness of the cultural diversity and meeting these patients' needs in all of society. Thank you.